Like all healthcare professionals, nurses have many variables to consider when administering patient care. This is equally true in community, hospitals and aged care facilities. A patient's medical history, a patient's goals, and the availability of resources are just some of the factors a nurse must consider when delivering the best care possible. Patient care plans and pathways are critical tools that help nurses to organise patient care using a holistic approach. They are a roadmap to recovery and help guide everyone involved in the patient's care, including family. In this programme, we'll give you an introduction to patient care plans and pathways. We'll begin by defining plans and pathways, before looking broadly at some examples of typical plans and pathways. We'll then get into the finer details of general patient management plans and clinical pathways, then analyse the growing use of computerised patient care plans. We'll also get some invaluable insights from experienced nursing professionals. A patient care plan is a nursing diagnosis and organisational tool that outlines the care to be provided to a patient, either in a community or hospital setting. In community settings, patients may contribute to constructing care plans by filling out questionnaires. Hospital plans are most often constructed in a more collaborative way. Nurses work with patients to establish goals and needs and include their medical history, their family's wishes, and information given by nurses, doctors, and other relevant specialists. Patient care plans guide everyone involved in helping deliver the highest level of holistic care possible.
Patient care plans are very, very useful in that they allow everyone to be on the same page with the patient. They're worked up in collaboration with the patient, and they give all the people who are providing care the same information. So if you have a patient with a chronic wound, for example, they may be receiving care from a number of nurses over the time that they're in hospital, and maybe a podiatrist. And so all of that information is actually communicated to people at the change of the shift and around the length of stay on the same document. So it's a very, very useful multidisciplinary tool.
Care plans are also a reference point for medical staff to resolve patient problems during care and assessment. They are useful for risk assessment and help to map the steps to achieving a patient's goals. They are used in all healthcare facilities, from hospitals to psychiatric clinics, to private practices and care centres. As we will explore later in the programme, there are many types of patient care plans. They can be general or specific, depending on the seriousness of a patient's condition and whether goals are long or short term. However, there are some typical steps common to the development of all care plans. A care plan will typically begin with an assessment of the patient's collected information, including medical history, present conditions and goals. It will then move into the planning stage. Planning is typically done in conjunction with all members of the interdisciplinary team involved in the patient's care.
The patient care plan always has an interdisciplinary team approach because it allows each member of the multidisciplinary team caring for the patient to actually communicate together. If the patient care plan is one discipline specific, such as nursing, then other members of the team may not actually read that plan and may feel excluded from being involved in their care planning decisions. So it's very important that the plan is developed with other members of the healthcare team.
Once planning is complete, the next stage of the care plan is implementation, or carrying out of the plan of care, followed by evaluation. Evaluation is a critical step involving review and revision of the care plan as the patient's needs change. A patient care plan is a roadmap guiding everyone involved in a patient's care. They are collaborative, involving input from all relevant medical staff, the patient, and the patient's carers. Care plans are used for organisation, problem solving, and risk assessment. There are several types of patient care plans and pathways. What plan is best for which patient depends on several factors, including urgency and severity of the patient's condition to past medical history.
So the different care plans are used based on the routine nature of the care that you're providing. So the less routine, the more you need to go for the individual care plan, and the more routine, and it may be very complex routine, such as bariatric surgery or a cardiac case, but if you're working in a cardiac ward and most of your patients are coming in for a stent, you would have a clinical pathway.
One of the most common types of patient care plans is the General Patient Management Plan. This generic plan is used to provide consistent treatment to patients with a variety of symptoms. Other common types of patient care plans include the 4-day care plan and the emergency outpatient care plan. The 4-day plan is for short-stay patients needing minor procedures or treatments, as well as monitoring post-treatment and pain management. Each facility usually has its own unique 4-day care plan. Emergency care plans are usually created from a generalised admission form with the input of triage care. When a patient's progress deviates from the expected course, a variance care plan may be used. They are required when additional intervention is needed for the patient to reach a complete recovery.
A variance care plan is when you have a clinical pathway, and so you have a standard group of procedures and activities that you would provide for a patient, and then the patient's condition changes from that. They may have a deterioration, they may develop a post-operative condition such as an infection. There may be some difference from what you would expect in a normal routine passage through the hospital. And so those things are called a variance. And then a variance care plan is an individual care plan that's developed for that patient based on that change in their condition.
Clinical pathways vary slightly from the individualised patient care plans we have discussed. They are multidisciplinary, systematic care tools that aim to improve patient care across a range of sectors.
A plan is different from a pathway in that a plan is individualised for each patient. A pathway is a standard group of activities that would be common in a patient who is coming for a routine type of activity.
Patient care plans and pathways vary according to patient needs and conditions. Influencing factors include the severity of a patient's condition and anticipated length of care time. There are various forms of generic care plans, individualised care plans, and clinical pathways that approach care in different ways according to the needs of patients. We're now going to look at general patient management plans in finer detail and analyse some of the important factors in their implementation.
A general care plan is when a patient comes into hospital just for a general episode. It's based on the nursing process, so it enables you to actually have assessment for the patient, have some diagnosis, and now it enables you to actually put a plan into action to meet whatever you've actually identified in the assessment processes, and enables you to implement any interventions and to evaluate those interventions to make sure that the patient's actually fine during that particular care.
One of the primary considerations in a general plan is gathering any patient information that might influence the patient's condition. This information is generally gathered through a questionnaire or interview on admission, covering things such as medical, social and personal history, goals, and whether they smoke or drink alcohol. A nurse also needs to consider what physical and specialist resources are available to the practice or hospital. Costs for the patient are also considered, so contact with health insurance carriers and assessment of Medicare might be incorporated into the general care plan.
The types of care plan that I would do as a general care plan, the GP management plans that we do, that the government have created for clients to be able to access Medicare benefits out in the community. Now that would be an example of a general care plan. These patients can access osteopathy, physiotherapy, OT, chiropractic, all of the allied health services in the community that don't normally attract Medicare benefits. So you have to start in a general way. You have an idea when they first come in because of their problems.
A nurse must also assess any potential barriers to care in a general patient management plan. Are there any cultural barriers to care that need to be respected? Is there sufficient time for planning? And has allowance been made for revision and evaluation? Have all variance potentials been assessed and incorporated? There are several factors involved in the development of a general patient management plan. These include the patient's condition and requirements and the availability of resources. Other considerations include potential barriers to care such as time, cultural differences and cost, for example where the patient is in a private health setting. Pathways have been used in healthcare since the 1980s. They are a technique for multidisciplinary care planning. Clinical pathways are not as individualised as patient care plans and provide guidelines for the standard care needed for certain procedures and illnesses.
The aim of a clinical pathway is to get the patient to a point where A, they can be discharged from a hospital, or B, quality of life, if you like, that they can manage. So it's to get them back to a good quality of life, to manage their ADLs, their activities of daily living.
Clinical pathways are outcome-focused and are designed to enhance the coordination of care across different disciplines and sectors. While they are used to facilitate earlier discharge of patients, the challenge for nurses and the care team is that the clinical pathway protocols reflect their beliefs about care. Like care plans, information gathering is key to successful clinical pathways.
If you don't get your information at the beginning of a clinical pathway, then you're not going to get anywhere. So it's basically what's wrong with the patient, where do you want to go with their plan, and what result you want at the end of it.
Clinical pathways are ordered by physicians for appropriate patients. Since all patients are unique, everyone's care must be customised to meet their needs, while keeping the guidelines of the pathway in mind. Clinical pathways help to reduce risk by minimising variations in practice. The monitoring of variance data is a critical component of the pathway. Variance data is recorded on the clinical pathway documentation and reported back to key figures in the care team to help drive any improvements to the patient's care that may be needed. Clinical pathways provide the care team with specific care guidelines for patients with particular illnesses or needing specific treatments. They are not as individualised as patient care plans. They are designed to coordinate care across multiple sectors, focus the care team on outcomes, and reduce resource wastage and risk by minimising variations. Documenting a patient care plan is time-consuming. Nurses need to continually log information about patient assessments, diagnosis, implementation, and evaluation of overall care, as well as the progress of the patient. Computerised patient care plans are gradually being introduced into many hospitals and care centres around the country. They offer an effective solution to help reduce this workload. By streamlining many of the processes involved in care plan documentation and greatly improving time efficiency. Consequently, they can reduce workplace stress associated with high workloads and staff shortages.
They can increase efficiency because you're no longer waiting till the end of the shift to actually sit down, get all your paperwork and start documenting things, or getting bits and pieces of paper out of your pocket, like where you've written some patient's observations or something like that, like they may have done in the olden days. You've actually got a port you can go to, or if you've got it in your pocket, so to speak, you can actually upload the data straight away. So it's quite good and timely that way.
Computerised care planning can also help reduce medication errors and speed up treatment orders. Innovations like Palm Pilots and Computers on Wheels, or COWS, offer even more exciting treatment capabilities.
When we use a computer on wheels and we just cruise it from bed to bed, we can use it for a range of things. We're also using it for wound care, care planning, and so we're actually taking a digital image of the patient's wound and uploading the image and being able to work with that straight away at the bedside. So it's very, very useful.
Computerisation also aids in the implementation of clinical pathways by connecting nursing stations to ancillary and administration departments. Computerised patient care plans are an effective solution to the large workload of care plan documentation. By streamlining access and modification to patient information, they greatly improve efficiency and reduce stress in the workplace. By connecting nursing units to other departments in a hospital or care centre, computerisation can also aid in the implementation of clinical pathways. As nurses continue to be deployed to different areas and shifts, working casual, part or full-time, the need for continuity of patient care becomes even more important. Patient care plans and pathways offer a framework for this continuity and are critical tools for all healthcare professionals. This systematic, holistic and multidisciplinary approach to healthcare improves the experiences for everyone involved: healthcare professionals, carers, families, and most importantly, the patients themselves.